Hello all of you, welcome back to our channel which is Study Smart with me. Today we are back again with a video related to the questions, and we'll be discussing with the question 52 today. A patient underwent surgery for the varicose vein. He now complains of sensory loss over the medial aspect of the leg and foot. Which of the following nerves most likely to be injured? So what happened to the person was having a varicose vein and he got a surgery for that. Now he's complaining some sort of a sensory loss. Okay, now what would be the answer is saphenous nerve. Okay, answer is saphenous nerve. Saphenous nerve is a L3 L4, descends with the superficial femoral artery and pierces the roof of the lower quarter of the adductor canal, where it comes to lie deep to sartorius. Here it gives off an infrapatellar branch through that muscle to supply the skin medial to the knee and distal to the patella. Main nerve pierces the deep fascia lata just above the knee and appears in the superficial tissues at the level of the knee between sartorius and gracilis. At this point, nerve lies and posterior to the LSV, separated from its subcutaneous fat. Here I have just written some sort of the description related to the saphenous nerve. Okay, so you have to go through with that. So the nerve supplies branches to the skin of the medial surface of the calf and the ends in the skin of the medial surface of the foot. So this is the image. Circumflex celiac vein, this is the femoral vein, you know this. This is superficial epigastric artery, this is superficial external pudendal, and this is great saphenous vein, and this is the saphenous nerve from here. Now this is another diagram I have put over here to make sure you to get the complete intervening of the saphenous nerve. Now this is the question, identify this. Yeah, pancreatic islet cell. The endocrine pancreatic islet cell appears as a pale staining complex in the middle of the field. Okay, where it lies in the pancreatic secretory acini exocrine pancreas. Also, pancreatic islets contain rich vascular supply, which is the capillaries and multiple islet cells encased in a thin connective tissue. Iris of the pancreas is also known as iris of the neck and isthmus. You have to remember. Okay, this will grouping of the pancreatic endocrine cells embedded with a rich background of the acinar exocrine tissues. Endocrine cells of the pancreas represent 2% of the pancreatic volume. Okay, the islets of Langerhans in the pancreas are composed of various cells which include beta, alpha, delta, TP, epsilon, G and EC cells. Okay, so this is the image I have covered. You can see this is the capillaries. Okay, let's see another question. Pen test is used for which nerve? You know this. Okay, pen test, abductor pollicis brevis, Oshner's clasp chest flexor digitorum profundus, hand of benediction flexor digitorum profundus, opponens pollicis. So I have covered a lot of things with the description part. You have to go through with this. Okay, if I am leaving it, doesn't mean to be that it is not at all important. I know you persons like the short videos only, so I am covering the main part from my video. You have to go through with my words too, and whatever I am leaving, you have to at least read it. Okay, a small boy with multiple fracture of humerus, loss of sensation over lateral side of forearm, difficulty in flexion and elbow and supination of forearm. Which nerve? Yeah, musculocutaneous. C5, C7, motor function muscles in the anterior compartment of the arm, where it involves coraco, biceps brachii, brachialis. Sensory function, it gives rise to the lateral cutaneous nerve of forearm that will innervates the lateral aspect of the forearm. These muscles flex the upper arm at the shoulder and the elbow. In addition, biceps brachii also supinates the forearm. You can see this. Getting this? Then see this also. See this, I am telling you, there are a lot of things I have covered through this images also. Don't you dare to leave these images, okay? Yeah, which blood vessel carries deoxygenated blood back to placenta? Umbilical artery. The umbilical artery carries deoxygenated fetal blood toward the placenta for replenishment, and the umbilical vein carries umbilical artery carry deoxy, umbilical vein carry oxy. See the circulation of fetus. Read it when I am saying. See it when I am saying. Fetal circulation. I have searched a lot of images to put everything in this content, okay? So here I am like stopping this video. So thanks for watching my video. Stay connected with my channel. You have to subscribe, you have to like my video, and you have to share. Okay, thank you, bye bye, take care.